It's fair to say that the mouth is a reflection of general health and well-being, and unfortunately, consequential oral health disparities exist within the American population. To combat these disparities, the CDC has initiated a cooperative agreement program called the State-Based Oral Disease Prevention Program, which provides financial support and technical assistance to oral health prevention programs across the nation. To achieve the overall goal of preventing and controlling oral disease and its conditions, the CDC continues to update its strategic plan to guide the program's work for the next 5 years. Within this strategic plan, there are 8 separate goals the CDC hopes to fulfill. The first goal is to prevent and control dental cavities. Despite water fluoridation efforts, 75 million Americans still do not receive fluoridated water. As a result, millions of Americans have cavities, and if left untreated, can lead to pain, dysfunction, and poor appearance. Tooth decay affects more than 1/4 of U.S. children aged 2 to 5 and half of children aged 12 to 15. 1 in 4 kids from low-income families have untreated cavities, and 96% of adults aged 50 to 64 years have had cavities. The CDC believes that strengthening activities to monitor the burden of dental cavities through national and statewide surveillance will reduce the prevalence of dental cavities amongst U.S. citizens. The next goal is to prevent and control periodontal disease. Severe periodontal disease affects 4 to 12% of adults. Periodontal disease can lead to tooth loss, impaired dental function, and diminished quality of life. It may also put you at risk for certain systemic diseases such as cardiovascular disease, diabetes, and reproductive outcomes. The CDC believes that more work must be done to build an evidence base of effective strategies in intervention in periodontal disease. Along with periodontal diseases, the CDC seeks to prevent and control oral and pharyngeal cancers. Oral and pharyngeal cancers are cancers of the tongue, lip, the floor of the mouth, and various other areas within the mouth. In 1 year, 36,000 people will find out they have mouth or throat cancer, and almost 8,000 will die from these cancers. Early detection is important, and intervention efforts need to focus on populations at high risk, such as smokers and alcohol users. With almost all health issues, there will always be disparities. Oral health is no different. Reducing the prevalence of disparities in oral health is of major concern and something the CDC is trying to eliminate. Disparities exist within families of lower socioeconomic status and amongst different races. Preschoolers from low-income families have nearly 3 times as much untreated tooth decay as children from higher-income families. The prevalence of untreated tooth decay among blacks is more than twice that of whites. To reduce and eliminate the disparities of oral health, the CDC will continue to monitor the burden of these diseases and broaden the understanding of health disparities. Goal number 5 is to promote prevention of disease transmission in dental health care settings. The CDC has set the standard for dental office infection control practices in the U.S. The CDC understands implementing these recommendations can minimize the risk for disease transmission in the dental environment. The CDC is adamant about maintaining the current high levels of infection control guidelines and will continue to promote awareness of these guidelines. The CDC also has the goal of increasing state oral health program infrastructure capacity and effectiveness. For over 15 years, the CDC has provided support to selected states through a cooperative agreement program. This program helps build infrastructure and also strengthens states' capacity to provide oral health promotion and disease prevention programs. Future funding and investment are needed to implement these programs in more states. The CDC's oral health program continues to educate state policymakers about the importance of oral health and effective interventions to prevent oral diseases in kids and adults. The CDC also plans to explore ways they can influence policies to improve the nation's oral health. The CDC recognizes that great leaders are needed to implement changes in the oral health program and assure an efficient and effective organization. Partnerships are essential for accomplishing the oral health program's mission and furthering its goals. The CDC hopes to increase the dental workforce and has made strides to do so through the residency program. There has been impressive strides and improvement in the nation's oral health, but some challenges remain, such as access and affordability. The CDC recognizes these disparities and has set in motion goals and objectives it hopes to fulfill over the next 5 years so that everyone can enjoy a set of pearly whites.